states to take stock of the COVID situation in the region. Now, it turns out that the situation there isn't as happy or as pleasant as perhaps some other parts of the country. There are districts which have reported a positivity rate of more than 10%, and which is why Northeast is emerging as some sort of a cause of concern as far as the COVID situation is concerned. To help us understand what the statistics in the Northeast tell us and what the government is doing to try and address the COVID situation there, Abantika Ghosh, who as you know tracks health for us and heads our COVID coverage, is with me in this episode of Government Matters. So Abantika, let's just talk numbers a little bit to give context to what is happening in the Northeast and why is the situation perhaps a little alarming.
Well, you mentioned 10% because that's the criteria. I was going through some of the positivity rates. Arunachal Pradesh, I may not pronounce the name of the district correctly, Kurung Kume has a 95% positivity rate in the 28 June to 4th July week.
Wow.
And a district called Anjo has a 97% positivity rate in that same week. This is obviously like huge, but even others. There's a district called Ribhoi in Meghalaya, which is 33%. Khwai in Tripura is 23.9%. South district of Sikkim is 25%. Nagaland, a district called Mon, is 32.3%. So it is very alarming. But here's the thing, it's not like they are testing less. I was looking up some numbers. Tests per lakh, if you look at, India is about 31,139. Okay. Assam is 47,443. Manipur is 31,018. It's a little less than the national average. Tripura is 34,388. Arunachal, that we were just talking about, that's 55,074. Mizoram is 43,752. So obviously they are, Sikkim is 26,180, which is lower than the national average. So that in itself is not the problem.
Right.
The problem possibly is that they are not testing strategically, they are not pushing up testing where it needs to be pushed up.
More targeted testing.
Yeah, more targeted. Though again, high positivity rate, one way of, so for example, Kerala has a high positivity rate and they have been saying that we are getting it because we are doing targeted testing. We are not testing, we are not wasting tests. So something clearly is happening. And then another number, vaccinations.
Right.
In India, 21.92% of the population has received at least one dose. Okay. Sikkim, that's 64.08%. Arunachal Pradesh, that's 37.79%. Manipur is 25.28%. Meghalaya is 21.16%, that is slightly less than the national average. Assam is 18.71%, less than the national average. Nagaland is 22.47%. So it is again, there is a bit of vaccine hesitancy that, as Simran Sarur, who's been traveling in the Northeast for us, she reported about it. There is a bit of vaccine hesitancy. There are places which are very hard to reach. So in Manipur, there was a place that she accompanied a team to, and that entire exercise took 10 hours, of which 6 were spent on the road getting earth movers to clear the road and all of that. So these are remote areas, there are problems, but their numbers per se are not so bad. Now, another thing that we need to look at is that this is the first time Northeast is really erupting, and one important factor in this is vulnerability. How much the disease will spread depends on what is the amount of population that is available, that is virgin, that can be infected, that can spread the disease. So every place that has had a big outbreak last time would reasonably be protected by that bit of herd immunity, if you want to put it like that. But here, I think the vulnerable population would be much more, because the last two waves did not, because we are really not even out of the second wave, and to that extent, these numbers now are a part of the second wave. So the last 1.5 years, did not affect the northeast that much for whatever reasons, because social distancing is easier to practice there. It's the population density is less. People live in houses which are far away from each other. Villages have like less population and all of those things. Maybe what helped them last time is now coming back to
vulnerable.
Yeah.
Right. In fact, our colleagues Simran Sirur and Nikhil Rampal did a detailed story on numbers in the Northeast. So you can log on to our website, ThePrint.in, to read that. Okay, so Abantika, this is a question from Rajesh, and that's really, quite an obvious, it's a question that everybody perhaps wants to ask. Why is there a sudden spike in the Northeast, apart from the fact that you mentioned that a large part of the population is perhaps vulnerable now? Are there other factors that perhaps have played a role?
So I think any place which has has the experience of an outbreak, even in Delhi now that acute stage is over, you see a lot more violations, people out on the roads and all of that. Here, remember, we are talking about a population that has not even seen the full extent of the damage that this disease can do. We just saw it, and look at us going all over the hills and everywhere.
Right.
Or even on Delhi's roads. Violations are so high. So I think there's a bit of complacency that creeps in when you haven't seen what the disease can do, and then you start thinking all those things that India thought after the first wave, that we have better immunity because we are exposed to more germs and whatnot, BCG and all of that. So you sort of start believing it, and now see, three things are important: a vulnerable population, violations, and lack of past exposure, lack of immune response, either because of a past infection or because of vaccination. Now these three things, when these three things come together, that is when there is an outbreak in a place. Now clearly, as I mentioned earlier, something is going wrong in specific districts of the Northeast. Either probably there is more hesitancy, people are reluctant to get tested. I don't know what is happening in these specific districts, and that needs to be examined. And like we've been saying from all this while, that one size fits all does not work.
Right.
It is possible that the measures that worked here would not work there. So it has to be sort of calibrated. For example, Simran, the same story that you spoke about, she wrote a very interesting thing about a district commissioner who had mandated that a village which is less than 50% vaccination rate will not get NREJ work. So those sorts of things, I mean, it's controversial because our policy is that it is not mandatory, it's voluntary. So to rob somebody of what is their legal right is a bit of problem area. I'm not getting into that, but all I'm saying is measures need to be calibrated, measures need to be adapted to the social realities of a place.
Right, so more customized measures instead of this one size fits all approach. All right, okay, so let's talk a little bit, because there are questions about that as well, about the outcome of the meeting today. What did the PM say, and what are the plans to try and contain the situation there?
So some of the things that he said are generic, in the sense that test more, track, treat, test, track, treat, which has been our policy all this while. Another thing that he talked about was micro containment zones, that have small containment zones and have people responsible for them, so that when it works, you have somebody to say that, oh, you did a good job, or when it doesn't, you have somebody to go back to and ask, not just for a blame game, but to understand what went wrong, so that you don't repeat that mistake. So when you're looking at a larger area, it is more diffuse, so it is more difficult to sort of hold people accountable or do measures that are adapted to that place. In a micro containment zone, that is
more accountability is
more
possible.
Accountability, also more possible to adapt it to the local situation. That is one. Then all of us have seen these very scary video from Kempty Falls. The Prime Minister actually spoke about that as well. He said that we have to be careful. We can't, the crowding in the hill stations and all this revenge traveling, that's my word, not his, is sort of very worrying. And he also made the point that people keep asking us that how are we preparing for the third wave?
Yeah.
But what our focus should be that we don't let it happen. So those broadly are the messages. The Home Minister also spoke to the Chief Ministers, and he spoke about the need to increase testing, to boost medical oxygen supply, and the 23,000 crore package that was announced for health. Prime Minister also spoke about that being used to boost health infrastructure in the northeastern states, because remember, these are states where there are many remote areas, access is limited. There are only regional medical college rooms. Manipur is one. I think there are just a handful of those medical colleges in that entire area, so which is like a tertiary care center proper good. So he said that maybe we need to set up temporary hospitals in areas which are underserved. So these are some of the things he spoke about.
All right. Okay. So there is this question from Suresh. Even the tribal communities are at risk. What is your view? Is another lockdown a solution?
So I think lockdown. So for example, these two districts that I spoke about, I think they are crying out for lockdown. Without knowing anything. That's my disclaimer. But they're crying out for lockdown. When you have like 95% positivity rate, what else do you do? And I am actually, though the real criteria for that, and there are some very good models that are being developed in institutes like the Indian Statistical Institute, where they have actually put graphs together where you can plot that, what is your health infrastructure availability and how many days till that is overwhelmed.
Right.
So that should be the ideal criteria. If you can do that kind of a calculation, and you can predict that, let's say in the next 7 days my health infrastructure is going to be overwhelmed, that's when you drastically do something, and that's lockdown.
Right.
So a lockdown may be a solution, but again, locking down the entire northeast cannot be a solution, because there are also places with far less positivity, far less numbers. So any measure, be it a lockdown, be it anything else, should be localized, should be in small areas, and should be there's a huge diversity of people, of like tribals, tribals, religions, lots of things. So these things should be taken into account before any measures are taken. But I think it's also very important to constantly talk to people. And I'm very certain violations have been high for the situation to reach this stage. So I think it's very important to constantly communicate and tell people why it is important to follow COVID appropriate behavior.
Right. I remember when I went to cover elections in Assam, Abantika, nobody was wearing masks. Nobody. I mean, in rural Assam, it was almost as if they had never thought or heard of COVID.
But then the current Chief Minister
then Health Minister and now Chief Minister said no need for masks, which is perhaps why. All right. Okay, so Jayesh, are these cases of Delta virus or Delta plus?
So genome analysis is one of the things that will be stepped up. It is right now that information is not available, whether this is Delta or Delta plus, but it doesn't matter, because the essentials of your containment are the same. It has no bearing except for the fact that it is more infectious. But even the more infectious, none of these variants are so infectious that they penetrate your mask or they jump across from like a long distance away. So these basic measures still work. I'm presuming, because of the way Delta has sort of covered the entire country now, almost, I'm presuming a lot of these would be Delta plus.
Right.
But that information is not right now available.
Okay, so I'll club these two questions. One is from Pravina, who wants to know whether the Northeast is prepared for a pandemic in terms of beds and other COVID resources. And Viren is asking whether a third wave is coming and whether the Northeast could be at the center of the third wave.
Okay, so both of these require a bit of sort of, the second question certainly needs crystal ball gazing, which the powers I don't have. But it is possible that Northeast can be the center because of the reasons that I earlier mentioned. A big vulnerable population, though in terms of numbers the Northeast population is not that much, but a vulnerable population is a very key ingredient of a third wave, so that is available in the Northeast. As for the health infrastructure, as I mentioned, tertiary care is limited, PHCs are there, but often, you know, people have to traverse through
Right.
very
Access is a
difficult,
big problem.
yeah, very difficult terrains to reach those PHCs. You know, or these, the Assam, for example, the vaccination, where the boat vaccinations that happen in Assam. So those are the kinds of terrains where health workers have to work, or if I put it the other way, that's the kind of distance that people have to travel before they can access healthcare. So I think that is a big problem, and that is why this point that the Prime Minister made about the need to probably set up temporary hospitals from this 23,000 crore package. So yeah, those things, but I mean, Northeast I think is worse off than many other parts of the country.
The topography, geography also makes it a very difficult region to.
That's right. Topography makes it very difficult. Also, somehow compliance levels are a little problematic in Northeast. So yeah.
All right, okay. So let me quickly take this last question because I know you have to go for the Health Ministry briefing. I have to let you go. This is from Saksham. What about Maharashtra and Kerala, which are currently the rising hotbeds of infections too?
Maharashtra and Kerala are something very interesting is happening in both these states. Numbers are plateauing. They're not going up, they're not going down. Now, this could have many reasons. I can't say. One reason could be Kerala, for example, has fully vaccinated population is 10%. That's fairly high in terms of, because the Indian average, national average is 5 point something. So that's pretty high. And also both these states have had a massive amount of infections earlier. So there would be a bit of residual immunity from that. That could be one reason why cases are not going up. It's plateaued. So this would probably mean that there is an equilibrium that has been achieved between prior exposure to the virus, some sort of immunity, either because of vaccination or otherwise, and violations, traveling, for example, because nobody is restricting traveling now.
Right.
Kerala, I was talking to some people about Kerala. Kerala probably has a lot of cases coming in from outside the state. Maharashtra also, that could be happening. But Maharashtra, more worryingly, is now adding so many backlog deaths that I am really now confused. Not just me, even the Health Ministry is beginning to get confused as to the full extent of the damage that the second wave did in Maharashtra. Because remember, at the peak of the second wave, when Delhi was literally reeling, everybody was talking about how well Maharashtra is managing, that despite the cases, the deaths are not high. But those deaths are now getting added now, probably. We don't know whether these are, because these are not, of these backlog deaths, we now only know the districts. We don't know when they happened. And it has been happening over such a long period of time that Maharashtra numbers really would need probably some reanalysis.
Right. All right. Okay. So we had many questions which unfortunately we couldn't take, from Anmol, from Vishal Thapa, from Sai Rakshit, from Sai Kiran Cheruku. So my apologies to our viewers whose questions we couldn't take, as I said, Abantika is in a bit of a hurry. But we'll try and respond to you through comments on YouTube. Also, I've been saying this in our episodes of Government Matters. We have a special feature now. You can take membership of our YouTube channel. There's a link given below in the description of the video. At just ₹159 a month, there'll be many benefits you'll get, including getting early access to some of our most important video properties, which also includes, of course, Editor-in-Chief Shekhar Gupta's flagship Cut the Clutter. So don't forget to take membership of our YouTube channel and keep watching Government Matters.